Welcome to the series Employee Health Services, Mind, Body, and Spirit. Employee Health is a section in the City of Albuquerque's Risk Management Division. Its mission is to promote a sense of community and increase wellness among city employees and their families by providing education and counseling about physical and mental health. And now, Mind, Body, and Spirit with Dr. Julia Bain. Hello, welcome to Mind, Body, Spirit. My name is Dr. Julia Bain, and today we are going to be talking about health promotion and City of Albuquerque employees, along with our community and along with you and I, is Lisa Catan with our Human Resources Department Health and Wellness Coordinator. Welcome to the program.
Thanks, Julia.
I'm so glad you're here.
Well, likewise.
You have been doing such exciting work with the city, with our employees, with a community collaborative of people, and you are the queen of health. I'm just going to dub you that right now.
I'll take it.
Lisa Catan, queen of health.
Oh, nice.
Tell us what your position is with the City of Albuquerque. How long have you been working for the city?
Well, I'm the Health and Wellness Program Coordinator, as you mentioned, with the Human Resources Department. I've been in this role for 1 year.
Nice.
And my role includes not only reaching city employees, Julia, I'm not sure if you're aware of this, but also the employees and family members of our 16 government entities that are enrolled in our health plan.
Wow.
So I have a wider reach than our 6,600 employees and family members.
16 government entities like City of Belen or?
Correct. In fact, we have Bernalillo County.
Right.
We cover Water Authority, Middle Rio Grande Conservancy District, Sandoval County, Town of Bernalillo, all the way down to as small as San Isidro and Corrales.
Wow.
So it's a total of 10,500 employees, and when you add their family members, it's a total of 24,000 people that I am tasked to reach with health initiatives.
Fabulous. You are a superstar. I bet you feel like one. That's a lot of people.
It's
a big responsibility, and I am looking forward to talking about this. I am so proud of you for this 5-year strategic plan that you have put together. And does this include the over 10,000 people you just mentioned?
It does.
Okay.
The 5-year plan is designed to reach all of those entities.
This is Lisa's walking apple. And like we were talking about before we went on camera, I feel good, da-na-na-na-na-na-na. I knew that I would now. I told you I was going to sing. So your mission, talk about your mission for promoting health among these 10,000 people.
Well, in the 5-year strategic plan, we have listed the mission to reduce chronic conditions associated with physical activity, tobacco use, and nutrition.
Okay.
We've
The
also,
big three.
Those are the big 3 priorities. And we have a vision of how we want to see that enacted among our audience. We would like to see more employees and their family members eating better, avoiding tobacco, engaging in adequate levels of physical activity, and beyond that, achieving and maintaining a healthy weight, healthy blood cholesterol, blood pressure, blood glucose, and improved mental health. So we have a big task to reach that vision and the mission, and we have identified 4 goals to achieve those. And then under the goals, we have 27 objectives outlined.
You are sharp as a tack. Plus, it goes back to the fact that you value people feeling good and living the life they want to lead in terms of quality and feeling strong and being able to, because sometimes we have to fight battles in this life, and we want to be well equipped and strong and ready.
We want our employees to feel good and to be at work and to work when they're at work and to feel valued with this program. This program has been around since 2007. It was formerly called Rising to Good Health.
Okay.
And we did change the name to Better Health Worksite Wellness Program.
Okay.
And our slogan is Better You. So with better health, you tend to be just a better person. You feel better. You tend to be a better mom, be a better sister, a better employee, a better friend. Just overall, you know, you're just a better person.
And a better
you feel good.
citizen.
And a better citizen.
I feel good. Presenteeism. We were talking earlier today about that, and it kind of goes along with what you're talking about, and I don't want to forget to mention it because I think it's really, did you coin that phrase or?
Oh, not at all.
Okay.
So we were talking about presenteeism in the context of, you know, the whole rationale for having a worksite wellness program is to reduce healthcare costs. And right now, the city and the 16 government entities are spending, last fiscal year, $75 million on our healthcare premium. Okay, that averages about $700 per employee per month. Okay, with the city taking a part of that cost and the employee paying a part of that cost. The costs are huge, okay, just in healthcare alone. So worksite wellness programs can help address the healthcare costs, but also what's costly to employers is the rate of absenteeism and workers' compensation. And within absenteeism, so it's a cost when people are not at work because they're sick,
Right.
but it's also a cost when they're at work, but they're not able to work to their full capacity.
Okay.
So that's the term presenteeism. In fact, it accounts for a lot of the absenteeism costs out there in not only the city, but our nation and worldwide. So it's a universal term.
Okay.
You know, it's a little hard to measure, but it's very real. When you're not feeling good, you can't work at your full capacity. And we want people to work when they're at work.
So this is not only magnanimous and kind and moral, it's also cost effective. It's also a payoff for our taxpayers that their money goes a longer way, so to speak.
Correct. And in the strategic plan, we do have an endorsement letter by Mayor Berry and Chief Administrative Officer Robert Perry.
Oh, nice. Yeah, let's look at this.
And they go on to say that, you know, we are wanting to be responsible with the money from the city. You know, we're responsible stewards, and we need to use our money in our most efficient ways, save money where we can. And this plan is designed as an economic
Sure enough,
tool
it's a proclamation.
to reduce healthcare costs and to spend our money wisely. You know, healthcare costs are just increasing at a rate that is truly not sustainable. We experienced about a 7% increase in our health insurance premium from last year. And that's been going on for the past several years. And nationwide, we're looking at 7 to 10% per year. So if you look at 10 years from now, that's 70% more than we're paying. You know, any business that has a 10% increase each year will have twice the healthcare costs in 10 years. How is that sustainable? Right now, we're paying $566 per employee per month. It's not sustainable.
Certainly not. And thank you, Mayor Berry, and thank you, Mr. Perry, for your support and your, you know, this, what you do, health promotion, it's about, you know, slowing down that lack of presenteeism, and it's about prevention, and it's about all things good in terms of a well workplace and full capacity. I like that term too. And so our administration realizes that.
They do. And we have delivered the strategic plan to all of our directors. All of the participating government entities have the strategic plan as well.
So you've got buy-in.
So we are definitely working to get the buy-in. And yes, we do have it. It's very exciting.
Very exciting. You've worked a miracle in 12 months.
I inherited a very good program, I have to say.
Oh, that's big of you.
Yes, it's, I mean, really, evidence-based initiatives have been in place since day one. So the city has been doing great things every year, and we're really building capacity, we're building momentum, we're getting better at it, in fact. And the plan, has some targets for how we need to engage a lot more employees, in fact, a lot more. So it's coming, but we have to have the mechanisms in place.
Right, and we're making a cultural shift, and the mechanisms in place. When you say that, I think about money. And in a perfect world, you would be able to throw all kinds of money at this. But I know that just like the rest of us, you're probably on a pretty tight budget. In a perfect world, let's say you could have as much money as you needed to do anything you wanted to. What kind of investment on your return do you think that we would get?
Well, return on investment is a challenging thing to measure. I need to put that out there.
Okay.
A researcher whom I like to follow, Ron Getzel from Emory University, he's now suggesting that for every dollar that a company invests in worksite wellness programs, they can see a $2 return in decreased healthcare costs, workers' compensation, absenteeism, presenteeism. So it's a win-win situation when the level of budget, when the budget is about $15 to $18 per employee per month. So we're at about 30% of that right now. But
one for the money, two for the show.
Go, go, go.
That would be great. Nice. And you're working your way in that direction, the best
capacity.
you can. Building capacity. Nice, nice. Did you want to talk about some of the programs you've implemented?
Sure.
Okay. And I just love this book. It's beautiful, beautifully done. Blood pressure, total cholesterol, strategic plan. I mean, people, look at these charts this woman can do. Are you really good at Excel? Or
I'm getting better. You've got to.
I can tell. So talk about your work. What are you doing?
Well, the 4 goals outlined in the strategic plan dictate the programs that we do.
Okay.
And we want to focus on using evidence-based strategies and initiatives. So
Evidence-based.
yes, crucial.
Proof.
So, yes, things that work. So we have looked at the HERO scorecard, which outlines these evidence-based practices for worksite wellness programs. So like strategic planning is a key component of any decent worksite wellness program.
Okay.
Senior level support, crucial. Evaluation and using evidence-based programs. So we identified the 4 goals of preventing, detecting, and reducing modifiable risk factors for chronic conditions such as cardiovascular disease, diabetes, arthritis, cancers, and chronic lung diseases.
Preventing, detecting, reducing.
Yes.
Okay.
Then our second goal is to create a healthy worksite culture.
Okay.
Because we don't operate in a vacuum. We're a part of a bigger picture, and so our environment influences our health behaviors. So we want to change the social norm around here and in all of these work sites to be one of health. Our third goal is to build...
But please keep bringing me the tamales, okay? Bring me the tamales. It's all good.
With a side of whole pinto beans, right?
Nice.
Yeah. See?
See?
Nice complete protein.
Yeah.
So the third goal is to build wide support and collaboration. And so, going to the senior leaders like we talked about, directors, managers, supervisors.
Yes.
And the fourth goal is to evaluate and continuously improve our initiatives. So we have to identify what we're doing well, what's not going so well, and what needs to be changed or even discarded. So we're open to all of that.
That's such an important piece that I think where a lot of programs fail, that they don't keep looking back and saying, are we really moving in the right direction? How do you do that evaluation part?
Well, we're wanting to build a framework for the evaluation. So we have several contractors in place that are doing health initiatives for us. We have our medical plan, Presbyterian. They have an excellent worksite component to our medical plan.
Talk about the mobile unit.
It's called, sure. So, Healthy Advantage isn't part of the Mobile Health Center, but Healthy Advantage, they conduct weight loss programs for us. They conduct all of the screenings that we do at our health fairs, where we look at blood pressure, cholesterol, even the mobile mammography van. We get 2 locations twice a year. So you're asking about the initiatives, and so I like to kind of think of them in terms of the strategic plan. This is just really a good focus tool for where we go, and so we just stay on track. And under the first goal, to prevent, detect, and reduce those risk factors, we have a new initiative for city and the participating government entity employees and family members. So
Nice.
Presbyterian is offering to us exclusively this state-of-the-art mobile health center. So this once was an RV, turned into a mobile unit, goes to about 14 locations, and employees and family members can see a healthcare provider on board at no extra charge to them, and they can be seen for routine physicals all the way up to urgent care.
Nice.
And they can get their blood pressure checked. If they have diabetes, they can have some of the screenings done for them to make sure that they're managing their condition well. Again, to
Nice,
save money, because diabetes in this case is so expensive.
Oh,
I mean,
gee.
About twice the cost for a person with diabetes in their healthcare costs than a person who does not have diabetes.
That's interesting.
We've got to help manage that condition. So the Mobile Health Center has been a hit, in our evaluation.
Okay, good.
People who use the center have, a lot of them, about a third, I believe, have said, if this hadn't been here, I don't think I would have gotten care. So that's a huge statement. They're raving about the staff, and we're diagnosing new cases of diabetes, hypertension. So these things, maybe we're catching them early in a state where we can reduce these risk factors, keep the glucose from getting out of control or the blood pressure from getting out of control, keep it in control.
Yeah, Lisa, management and control, not only for the individual, but when they go home to their families, they're not bringing home a bunch of potential flu bugs and germs and things. They're not going home to their family, who's eventually going to have to care for them because they just keep getting more and more chronic in their condition. And then also the work group. They're not going back into the work group just kind of ignoring this. They're saying, oh, wow, there's the mobile unit. Maybe I should go talk to some. And they take care of themselves. So it's a win-win-win for everybody in the community. Makes so much sense. Plus, it's free as part of our health benefit.
Right.
Oh, that's wonderful. Now, I haven't visited that personally, but I must say I did go to that mammogram RV. And I was a little like, You know what? It was the best mammogram experience I have had. I was greeted at the door by these two men escorted me up the steps of the RV. I felt like I had just gone to the Ritz-Carlton. They were so polite.
The red carpet.
I know. I get in there, I had the procedure done, and I left all within about 15 minutes. No waiting room, no carrying on, none of this. It was so, I felt healthy. And I felt really like this is what I'm going to do every year from now on. They made it so easy and just comfortable.
It's very efficient, as you mentioned, and an example of our senior leadership support. So for city employees, at least, we were given 30 minutes to go and have this mammogram procedure done. Because in the long run, it's keeping people at work. Even though we're taking 30 minutes to get this screening, it could save a life, and it could save a lot of expense down the road if it's not caught early.
Right.
So when we want to catch things like this when they're treatable.
Absolutely. It was great. So we've got that Nuvita.
We have Nuvita. This is our third year. We're going into our fourth year of this program called Nuvita. It's a 12-week nutrition, fitness, and health program Team-based, web-based, and people that participate get a health coach and their own personal website, and they get an assessment before they start the program, one 12 weeks after, so that we can compare how well they're doing with their weight, how they're doing with blood pressure, all these things we're talking about.
Right.
And for those people that get engaged in this program, they are seeing really good outcomes. They're improving strength, they're improving flexibility, decreasing blood pressure, losing weight, and it's working.
I did it. I'm in week 10, and it is working. My clothes fit better,
Nice.
and guess what else?
Tell me.
I was under the delusion that I was doing all this cardio at the gym. Wrong, because I've had this watch, I'm held accountable, and the truth be known, I was not doing enough cardio at all, and it has been wonderful. And the team spirit, among people in terms of, my department, DFAS, and it's just, talk about a great investment.
It really is. We are reaching about 500 employees every year, and we spend about $500 per employee. And next year, we are going to include spouses or domestic partners because we do, like I mentioned, my goal is to reach not only employees but the family members. So this is one way that we think we might be able to get some of this really great education. The cardio monitor, people can track their nutrition and how well they're eating, and they get feedback, immediate feedback on how well they're doing.
Right.
So if we can get it into the families, we might be able to improve health even further.
Plus that $500 is going to pay off when I won't have to have my $500,000 heart transplant.
Exactly.
Since I'm not cheating myself in the gym anymore. And I'm really staying on that elliptical for actually, 45 minutes instead of 15.
You're getting a good workout. I'm glad to hear it.
Lisa, you're wonderful. What else? We
Doing
have about 7 minutes.
Okay.
I told you it was going to go like this.
It's going fast.
You're doing a lot of good work.
Thank you. I'm really enjoying it, I have to say, and I have some great people that I'm able to work with. So under the goal to build support and collaboration, we've established a wellness committee, and since about May, we've been meeting monthly, working on a lot of projects, working on activities to support the goals. Another activity that we're doing is to create the healthy worksite culture. This is new, and we're wrapping it up, in fact, the development of these products. But we're creating guidelines to increase healthy foods in office celebrations. So, this is a voluntary thing, but it's a way to just try to bring more vegetables and fruit into the office. Try to bring more whole grains.
Eat food that's alive, you feel alive. That's my motto, and I believe that. I believe it.
Serve smaller portions of food. Bring more water. Bring foods with a little less sugar, salt, and fat.
But you can still bring the tamales.
And you can still bring the tamales, and it's just, it is balanced, but it's just a culture shift.
Yeah.
To say, we really are serious about our health.
And I've noticed a change. I have noticed people bringing in more fruit and more vegetables.
Oh, nice.
I've seen it this last year, since you've been here. And I want you to know, and I want the audience to know, that I said to Lisa before we did the show, I said, what an opportunity for me to get 30 minutes alone with you to be able to talk about the amazing progress you have made on our behalf. For city employees and 10,000 plus now, I find out, and I just want to thank you for your service and just how energetic you are and how you have brought the gift of enthusiasm to our workforce. Thank you so much.
Thank you. It's a pleasure, really.
I mean it most sincerely. You've done a wonderful job.
Thank you.
And I can already tell. I mean, the few potlucks I have been to, I have seen a change.
Nice. Well, we're still in the process of getting some posters produced.
Okay.
We talk to our employees, so not only city employees, but again, some of these entities we're involved in, And we said, if we develop some guidelines to increase the availability of healthy foods, what kind of tools would help you implement the guidelines? And they suggested some potluck sign-up sheets. You know, potlucks are big here with the city.
Yeah.
You know, I came here and we have potlucks a lot. And so, you know, the way that a lot of groups do it is by having the sign-up sheet. And so we have drafted 12 sign-up sheets. So we have, for example, the birthday celebration, the holiday potluck.
Right.
And people can either sign up to what's recommended, or they can put their own healthy foods in there. And we've got the guidelines on the top of every single potluck sign-up sheet.
That's a good idea.
So we'll be rolling that out soon, but we are working with the Produce for Better Health Foundation with their Fruits and Veggies More Matters campaign. We want to get their endorsement on all of our items. So it's coming.
Oh, wow.
Yeah.
Good. Yeah, half of our diet needs to be raw. Half of our diet needs to be, you know, fresh, fruits, vegetables. And like we were talking about earlier, when I eat that food, I crave it now. I want it. I can eat it throughout the day. I feel better. I just feel I have more energy. Versus, you know, having, you know, a big old, you know, half a pound hamburger and some fries. You're just like, oh, really? You know, it doesn't weigh you down like that.
Yeah, fruits and vegetables are really, really important, and beans as well as part of the vegetable component as a lean protein source.
And my Navita coach taught me, she said, Julia, food is medicine. I thought that was brilliant.
I like that.
I do too. Food is medicine.
Who said that? Was it Socrates or?
Well,
let
Lori
food be your medicine and medicine be your food. That's where she probably got it from, but I don't remember who back then said it. But
Aristotle?
Maybe.
It's one of those guys back in Greece. Okay, we only have a couple of minutes. So what kind of words of wisdom do you want to leave our audience with? Better health, better you.
That. And, you know, for those that own a business, if you don't yet have a worksite wellness program, consider investing in one, because you can see a return on your investment. You know, at the rate that we're increasing our healthcare costs, all organizations need it. Also, for those that are working on improving their health, you know, I just would say, you know, keep going, keep at it. It is possible. It takes time. Explore your resources. Check with your employer, check with your health insurance plan to see if there is any program that fits you at where you are in your life at the moment, because everybody's at a different place.
Yeah. Self-acceptance is important. You got to say, I love me, you know, and we're all a work in progress. We're all a work in progress. Nobody ever fully arrives. You know, I mean, we're like 10 seconds away from death, and we're just like, oh, wait, no, you know, it's like you've had your run, you know, and, but we all never fully arrive. So, anything else?
Contact me if...
Yeah, your phone number.
My phone number is 768-2921.
Or people can call 311 and ask to speak to Lisa Gatan in Human Resources. Okay, and say your number again?
768-2921.
Direct line. Direct line to Lisa Gatan. This is a gift. Run, get your pencil. You're fabulous. So much work on our behalf. I cannot thank you enough. And I hope that you will come back and talk about evaluation and progress in the future with us.
Oh, I'd love to.
And I appreciate your words of encouragement for people in the community who have small businesses. They can do this too. There's no reason why they can't do this too. And if you have any questions for Lisa, she is open and willing to assist you, help bring your health cost dollars down, and help your employees just become and feel like better people. Nice.
Thank you.
Thank you so much. You're wonderful. And thank you for watching. This is Dr. Julia Bain. Until next time, be happy and be well.
This has been Employee Health Services Mind, Body, and Spirit. For more information, call the City of Albuquerque's Employee Health Services at 768-4613. Let the Employee Health Services staff let you be your best at work, at home, and at play.